Madam President, distinguished colleagues, I would first like to offer congratulations to Dr. Tedros on hosting this 71st session of the World Health Assembly, and to thank the Executive Board and the members of this prestigious assembly for this unique opportunity to address our obligation to ensure that beyond universal health coverage, our people also have universal access to health. Universal health coverage includes the key components of the health system and specifically addresses all those resources that are necessary to ensure health and the efficient management of the system. In recognition of this, the government of Guyana has, and in keeping with the constitutional rights of all Guyanese, ensures that health coverage remains free for all. Madam President, it is evident that universal coverage by itself clearly is not sufficient to ensure health, well-being, and equity in health in our countries. While we are increasing access to the health services, we also need to address the social determinants of health, which will contribute towards the achievement of the Sustainable Development Goals. In Guyana, Madam President, there are still many challenges in relation to advancing towards universal access to health and universal health coverage, such as the segmentation and fragmentation of health systems and services, health financing deficits and inefficiencies, and health outcomes below expectation, among others. More importantly is our human resource gaps and deficiencies in the delivery of essential services. We are experiencing severe shortages in the numbers and range of skills offered to the public, including the number of nurses, doctors, and other health professionals. The number of doctors per population remains low at 14 doctors per 10,000 persons, and these skills are concentrated in the most populated areas and not sufficiently extended to the interior and rural areas of our country. Despite that, the road ahead for Guyana is a challenging one, Madam President. Our Health Vision 2020, a national health strategy for Guyana 2013-2020, was developed and will guide the way. Its main two pillars are universal health and addressing the social determinants of health to ensure equitable access to medicines and other health technologies, providing equitable access to people-centered care, strengthen integrated health service delivery networks and competencies for our human resources for health, building our information system for health for evidence-informed decision-making, thereby contributing to improving the health status of individuals, families, and communities with a vision that all people of Guyana are among the healthiest in the Caribbean and the Americas by 2020. In conclusion, collectively, I feel that our efforts can motivate more global action for active collaboration across different countries and sectors. We can share learned lessons, best practices, and promote close cooperation between governments to ensure that we achieve universal health, everyone, everywhere. I thank you.